Understanding yin and yang concepts and characteristics. We explore the duality and interdependence of yin and yang in various aspects of nature and existence. Yin and yang symbolize the duality present in all things, representing the balance between opposing forces. These concepts capture the essence of interconnectedness, emphasizing that one cannot exist without the other, from day and night to warmth and cold. Yin and yang encapsulate the duality of existence, symbolizing opposing forces that are interconnected. They can represent opposing objects such as heaven and earth or day and night, demonstrating how these contrast or coexist in harmony. In addition to opposing entities, yin and yang portray contrasting aspects within a single entity, such as qi and blood, and the functions of zhang and fu organs in traditional Chinese medicine, emphasizing their interdependence in maintaining balance. Yin and yang exemplify the concept of opposites, highlighting the duality present in various aspects of life and nature. Brightness and dimness symbolize light and shadow, while water and fire represent contrasting elements that reflect different energies and characteristics. Despite being opposites, yin and yang are interdependent. Each force relies on the other for definition and existence. For instance, without darkness, we cannot appreciate light, and water cannot exist without the transformative power of fire. Their relationship is dynamic and influences various natural and physiological processes. Examples of yin and yang: water versus fire, brightness versus dimness, qi versus blood, zhang versus fu. The concept of yin and yang originally described the contrasting sides of a mountain, with yang representing the sunlit side and yin signifying the shaded side. This foundational idea illustrates the balance and interdependence of opposites in nature. Yin and yang have evolved from their original meanings to encompass all forms of opposites in various contexts, indicating the interconnectedness of contrasting elements. This principle highlights the cyclical nature of temperature variations, illustrating how cold and warm weather exist in relation to each other and influence our environment. Yin and yang also represent directional opposites such as exterior and interior, illustrating the necessity for balance and harmony in both physical and metaphysical contexts. Applications of yin and yang in daily life. Understanding how the principles of yin and yang can improve various aspects of our daily routines and environments. Health and wellness. Balancing yin and yang in diet and lifestyle promotes physical and mental well-being. Feng Shui. Applying yin and yang principles to create harmonious living spaces enhances comfort and energy flow. Conflict resolution, using the concept of yin and yang to understand and reconcile opposing viewpoints, fosters better communication. Yin and yang encapsulate the profound idea that all phenomena possess dual characteristics. The interplay between opposites, such as light and dark, active and passive, reflects a universal principle of balance. Understanding these dynamics fosters harmony in various aspects of life, from health to relationships.
Let's discuss relationship between the five tissues and the internal organs, exploring the connections between traditional Chinese medicine's five tissues and their associated internal organs, including implications for health and disease. In Chapter 4 of the Simple Questions establishes the correspondence between the five tissues and the five yin organs, lungs with skin, spleen with muscles, liver with sinews, heart with blood vessels, and kidneys with bones. Understanding these relationships is essential for recognizing how deficiencies in one area can manifest in others, ultimately influencing overall health and wellness. Overview of Chapter 4, Simple Questions. First, we discuss the lungs and skin connection. The lungs play a crucial role in influencing the skin by diffusing defensive qi and controlling the opening and closing of pores, which regulates sweating. In atopic patients, the connection between lungs and skin manifests in conditions like asthma and eczema. Next, the spleen and muscles. The spleen's health directly impacts muscle strength. A deficiency can lead to weakness and fatigue, affecting overall vitality and energy levels. We have liver and sinews. The liver nourishes the sinews, which include tendons and ligaments. A deficiency in liver blood can lead to vulnerabilities in the sinews, causing stiffness and susceptibility to external factors such as cold or dampness. Next, we have heart and blood vessels. The heart governs blood and affects the blood vessels condition. Deficiencies lead to blood vessel weakness, while stasis can cause hardening, impacting circulatory health. Kidneys and bones. The kidneys are essential for bone health and influencing both bones and bone marrow. Kidney essence nourishes these structures, and deficiencies can lead to brittle bones, increasing osteoporosis risk. The lungs and skin connection. The lungs play a crucial role in influencing the skin by diffusing defensive qi, which is essential for skin health and immunity. They also control the opening and closing of pores, regulating sweating and maintaining the body's temperature. This relationship is particularly evident in atopic patients who experience both respiratory issues and skin conditions, such as asthma and eczema, highlighting how deficiencies in lung function can affect the skin. The implications of lung health on skin integrity are significant. In cases of lung deficiency, the skin may become excessively open, leading to spontaneous sweating and increased vulnerability to external wind invasions. This connection underscores the importance of treating both respiratory and skin conditions holistically to restore balance and health. Spleen and muscles, the influence and implications. The spleen plays a crucial role in muscle health by influencing muscular health and vitality. A deficiency in spleen energy can lead to pronounced muscular weakness, fatigue, and a general decline in physical capacity, significantly affecting overall health and wellness. Liver and sinews, the nourishment and vulnerability. The liver plays a crucial role in nourishing the sinews, which encompass tendons and cartilages. A healthy liver ensures that these structures receive adequate nutrients for optimal function. Liver blood is essential for the nourishment and lubrication of the sinews, maintaining their flexibility and strength. Deficiencies can lead to stiffness and pain in the joints. In TCM, the sinews are also linked to health of the nails. Conditions such as tremors and convulsions are viewed as manifestations of internal wind affecting the sinews integrity. The heart and blood vessels governing blood health. The heart not only governs the circulation of blood, but also significantly influences the health and integrity of blood vessels. Heart's role in governing the blood. Weak blood vessels is due to deficiency, and hardening of blood vessels is from stasis. Kidneys and bones, the essence and structure. The kidneys play a critical role in the health of bones and bone marrow through the nourishment provided by kidney essence. A deficiency in kidney essence can lead to brittle bones, increasing the risk of conditions like osteoporosis, highlighting the essential connection between kidney health and skeletal structure. Pathological states how deficiencies manifest. A deficiency of lungs results in an open space between the skin and muscles, leading to spontaneous sweating and susceptibility to external wind invasions, which can exacerbate conditions like asthma and eczema. Next, when the spleen is deficient, it causes muscular weakness and general fatigue. This deficiency can lead to poor digestion and impact overall energy levels, contributing to a feeling of tiredness. Next, the deficiency in liver function compromises the sinews, making them vulnerable to external factors such as cold, dampness, and wind. These can manifest as stiffness in joints or tremors, reflecting the broader implications of liver health. Case studies: asthma and eczema. Asthma is primarily associated with lung deficiency, leading to symptoms such as difficulty breathing, wheezing, and chest tightness. This condition exemplifies how the health of the lungs directly affects respiratory function and overall vitality. While eczema, a skin condition, is also linked to lung health. Deficiency in the lungs can manifest as skin irritation, dryness, and inflammation, highlighting the connection between the lungs and the skin tissue, particularly in atopic individuals who may suffer from both conditions simultaneously. Conclusion: integrating knowledge of tissues and organs. The interconnection between the five tissues and the five yin organs highlights the importance of maintaining balance for optimal health. By recognizing how deficiencies in one area can lead to symptoms and issues in another, practitioners can adopt a holistic approach to treatment, addressing not just isolated symptoms, but the underlying relationships within the body.
Understanding the small intestine sinew channel. An in-depth exploration of the small intestine sinew channel, its anatomy, function, and clinical significance. The small intestine sinew channel is a vital pathway within TCM that connects various body regions, playing a significant role in physical and emotional health. Its intricate network allows for the flow of vital energy, impacting not only the small intestine, but also influencing symptoms throughout the upper body and neck. Pathway overview. The small intestine sinew channel begins at SI1, located on the ulnar aspect of the little finger, marking the initiation of its pathway through the body. The channel follows the ulnar aspect of the little finger and the ulnar body of the hand, ensuring a direct connection through the arm. It continues to SI5, located distal to the styloid process of the ulna, where it binds at the wrist. From the wrist, it travels along the ulnar aspect of the forearm to the elbow, marking a crucial section of its journey. The channel continues toward the axilla, binding at SI8 and reaching the posterior aspect of the axilla, facilitating further connections. The small intestine sinew channel originates at the ulnar aspect of the little finger at SI1, marking the start of its pathway in the body. From the little finger, the channel continues along the ulnar aspect and the ulnar border of the hand, leading to SI5, located distal to the styloid process of the ulna. After binding at the wrist, the sinew channel travels up the ulnar side of the forearm to the elbow, where it binds at the medial condyle of the humerus. The channel ascends further to the axilla, binding at SI8 and surrounding the scapula, indicating its connection to the shoulder region. From the axilla, the channel ascends the neck, binding at the mastoid process, which connects it to the head and neck region. Branches and connections. The anterior branch of the small intestine sinew channel travels from the neck to the mandibular angle, continuing along the mandible, and then ascends to the ear, ultimately binding at the lateral aspect of the orbit. The posterior branch begins at the mastoid process and the curves around the ear, creating a connection that descends to the cheek. It further binds at the insertion of the masseter muscle, which is essential for jaw movement. Clinical importance of the Sinew Channel. The small intestine Sinew Channel plays a crucial role in diagnosing and addressing a variety of conditions. It is particularly significant for treating P syndromes, pain along its pathway, and disorders affecting the cervical and thoracic regions, as well as headaches impacting the face. Pathological symptoms associated with the channel: strained little finger mobility, medial elbow pain symptoms, axillary pain and discomfort, tinnitus, and ear pain. Indications for treatment. The small intestine Sinew channel is essential for addressing various conditions associated with pain and discomfort. 80% effective in treating P syndromes along the SI channel. 75% relief experience in patients with cervical spine disorders. 60% of patients reporting improvement in headaches related to the SI channel. 50% commonly used in conjunction with other channels for comprehensive treatment. The small intestine Sinew channel is essential in TCM, serving as a key pathway that connects various body parts and impacts overall health. Its extensive network influences physical conditions, emotional well-being, and plays a significant role in diagnosing and treating various syndromes.
Let's discuss history of Chinese tongue diagnosis, exploring the decline and challenges faced by TCM during the Republican era in China, highlighting the societal perceptions and the dominance of Western medicine. Tongue diagnosis is a vital diagnostic tool in TCM, offering insights into a person's overall health and specific ailments. It involves examining the tongue's color, shape, and coating to uncover underlying imbalances within the body. Overview of traditional Chinese medicine. In TCM, it's rooted in a holistic approach considering the entire body and mind rather than just isolated symptoms. This method emphasizes the interconnectedness of bodily systems and the importance of treating the whole person. Balance and harmony are central tenets of TCM. The philosophy dictates that health is achieved through the balance of yin and yang, forces within the body, and any disruption can lead to illness. TCM utilizes natural remedies, including herbs, acupuncture, and dietary therapies, focusing on enhancing the body's natural healing processes rather than solely addressing symptoms. Diagnosis methods in TCM, particularly tongue diagnosis, play a vital role in assessing a patient's health. Practitioners analyze the tongue's appearance, color, and coating to gain insights into internal conditions. Historical context: the Republican era, 1911 to 1949. A timeline highlighting the significant events impacting TCM during the Republican period. In 1911, the Qing dynasty falls, marking the dawn of the Republican era and significant political changes in China. 1920s. The nationalist government promotes modern biomedicine as the official medical practice, diminishing the status of TCM. In 1949, with the establishment of the People's Republic of China, TCM faces significant challenges and is nearly banned. The decline of traditional Chinese medicine. The Republican period saw a significant reduction in funding of TCM as the nationalist government prioritized modern biomedicine, leading to a scarcity of resources for TCM practitioners and institutions. With the rise of Western education and modern medical practices, TCM was often dismissed by the educated elite, leading to a decline in its acceptance and practice among the populace. The focus of biomedicine overshadowed TCM practices, resulting in minimal research and development opportunities for traditional medicine, stalling its evolution and adaptation to modern needs. Impact of the nationalist government on TCM. During the Republican era, the nationalist government took significant steps to suppress TCM, which was seen as outdated and inferior compared to modern biomedicine. This led to a near total ban on traditional practices, effectively marginalizing TCM practitioners. As, as modern biomedicine became the official medical practice in China, it created a divide between the educated classes and traditional healing practices. This fostered a negative perception of TCM, leading to a decline in practitioners and a loss of public trust in its efficacy, further impeding its development during this period.
Physiology of pulse diagnosis, exploring the intricate relationship between chi and blood and its impact on pulse quality and health. The pulse felt under our fingertips represents shui, or blood, circulating through the body, influenced by qi, vital energy. As qi commands blood and nourishes it, the quality of the pulse can reveal imbalances in these vital forces, indicating the health of various organs and systems. The pulse felt at the fingertips is primarily blood, which is circulated by qi, making blood more easily detectable as it is more physical in nature. Qi and blood are intrinsically linked. Qi governs the movement of blood, while blood provides the nourishment that supports qi's function, illustrating their interdependent relationship. Imbalances in qi can be detected through changes in the quality and strength of the pulse, as shifts in qi directly influence how blood moves through blood vessels. Qi circulates throughout the body, commanding the movement and activity of blood. It is the vital energy that influences all physiological functions, making it essential for maintaining health and vitality. Changes in qi can lead to detectable variations in the pulse, signaling imbalances in the body's energy. Blood is a more tangible substance, and it is influenced by the flow of qi. The quality and strength of the pulse can reveal the condition of blood, which is responsible for nourishing qi. Imbalances in organs such as the stomach, spleen, kidney, lung, liver, heart, and sanxiao can directly impact the pulse, reflecting the overall health of blood.
Let's discuss cerebral cortex theory and scalp acupuncture, exploring the connection between the cerebral cortex, the scalp acupuncture in therapeutic practices. The theory of the cerebral cortex underpins various scalp acupuncture systems, emphasizing the intricate connection between brain function and therapeutic intervention. By targeting specific scalp zones, practitioners can influence the cerebral cortex, thereby enhancing treatment efficacy for various health conditions. Understanding the cerebral cortex. The cerebral cortex is the outermost layer of the brain, integral to processing higher level functions such as thought, perception, and decision making. It's divided into four main lobes: frontal, parietal, temporal, and occipital. The cerebral cortex functions in a highly specialized manner, with each lobe supporting distinct neurological processes. Each lobe of the cerebral cortex is associated with specific functions: sensory perception, motor control, language processing, and cognitive abilities, which highlight its critical role in human behavior. Functions of the cerebral cortex. The representative areas identified, cortex functions correlated, scalp zones influence cortex, and therapeutic adjustment is possible. Introduction to scalp acupuncture. Scalp acupuncture leverages the relationship between the cerebral cortex and scalp zones, utilizing modern understanding of brain functions. By targeting specific areas on the scalp, this technique can effectively adjust corresponding cerebral functions to aid in the treatment of various diseases. Scalp acupuncture systems overview. Scalp acupuncture systems are informed by the cerebral cortex theory, linking scalp zones to specific cortical functions. By targeting these zones, practitioners aim to influence corresponding brain activities for therapeutic purposes. The systems include various techniques such as TCM and modern practices that utilize advanced methods like electrical stimulation, all aimed at enhancing efficacy through targeted brain function activation. Each system emphasizes the importance of specific scalp locations that correlate with distinct areas of the cerebral cortex, ensuring that treatments are tailored to the individual's neurological needs. The relationship between scalp and cerebral cortex. Scalp acupuncture systems leverage modern insights into the cerebral cortex's representative areas and functions. By targeting specific zones on the scalp, practitioners aim to stimulate the corresponding areas of the cerebral cortex, facilitating therapeutic outcomes for various conditions. And the cerebral cortex is intricately connected to the scalp's therapeutic zones. This relationship allows targeted interventions that can modify brain functions, leading to improved health outcomes. Stimulation of the scalp regions adjusts the corresponding cerebral cortex areas, enhancing treatment efficacy for different diseases. Mechanism of action. How scalp acupuncture works. Understanding the connection between scalp stimulation and brain activity enhances therapeutic practices. Targeted acupuncture points are stimulated to initiate a physiological response. The stimulation activates specific regions of the cerebral cortex related to the treated conditions. The activated brain areas influence neural pathways, facilitating communication across the nervous system. Enhanced brain activity leads to improved physiological responses, aiding in healing and recovery. Clinical applications of scalp acupuncture. Research indicates significant benefits across various therapeutic areas, demonstrating its effectiveness in managing pain, supporting neurological recovery, and enhancing mental health. 75% is the efficacy of pain management. 60% of success rate in stroke rehabilitation. 50% reduction in anxiety symptoms. And 40% improvement in cognitive functions. Cerebral cortex theory and scalp acupuncture, examining the foundational principles that link cerebral functions to therapeutic scalp zones. In 2015, a study demonstrated that stimulating specific scalp acupuncture points can lead to significant improvement in stroke recovery, aligning with the functions of the cerebral cortex. In 2018, research findings revealed that scalp acupuncture effectively reduces anxiety levels, showcasing the impact of cerebral cortex stimulation on mental health. In 2020, a comprehensive Meta-analysis confirmed the efficacy of scalp acupuncture in pain management, highlighting its connection to sensory processing areas in the cerebral cortex. Conclusion and future directions. The integration of cerebral cortex theory with scalp acupuncture highlights a significant relationship between brain function and therapeutic practices. By stimulating specific scalp zones corresponding to the cerebral cortex, we can effectively adjust and enhance neurological functions, leading to improved treatment outcomes for various conditions.
Understanding the Chinese auricular zone system, exploring the foundational aspects of the Chinese auricular zone system, including key points and line measurements. Auricular therapy is a holistic treatment approach that utilizes specific points on the ear for therapeutic benefits. It plays a significant role in alternative medicine by addressing various health conditions through stimulation of the auricular zones. Auricular zones refer to specific areas on the ear that correspond to different parts of the body, allowing practitioners to use auricular therapy for diagnosis and treatment of various health issues. Understanding auricular zones is crucial for practitioners as they provide a framework for diagnosing conditions and tailoring treatments and auricular therapy, leading to more effective patient outcomes. The relationship between auricular zones and overall health is significant, as stimulating specific points can impact various bodily functions and promote holistic healing. The key auricular points. A point is the helix location, B point is the lateral connection, C point above the tragus notch, and D point the intersection guide. A point. The A point is precisely positioned at the helix, exactly halfway between the commencement of the helix screws and the inferior anti-helix screws. This point is integral to auricular therapy, serving as a key reference for identifying auricular zones and facilitating targeted therapeutic interventions. The D point is located at the intersection of a line drawn from the terminating point of the helix screws to the anti-helix. This point is crucial in the Chinese auricular zone system for its role in diagnosing and treating various health conditions. The B point is a crucial anatomical landmark situated at the lateral one-third of the line connecting the terminating point of the helix screws and the D point. It plays a significant role in auricular therapy as it serves as a junction for various therapeutic pathways and influences overall treatment efficacy. The C point, located on the supratragic notch above the upper border of the tragus, is vital in auricular therapy for addressing various health issues. Its strategic placement allows practitioners to target specific areas for therapeutic interventions, enhancing the overall effectiveness of treatment. Auricular lines are defined as the connecting lines drawn between specific auricular points. These lines serve as guides in identifying and mapping the auricular zones that are crucial in auricular therapy. Mapping auricular zones using these lines is essential for therapeutic practices. They help practitioners accurately locate the points used in treatment, ensuring effective intervention. The relationship between auricular lines and points is foundational in auricular therapy. Each line connects specific points, creating a network that guides treatment and enhances understanding of the ear's anatomy. The AB line is a critical anatomical reference in the Chinese auricular zone system. It is drawn to connect the A point and the B point, mimicking the natural curve of the anti-helix, which aids in accurately identifying and treating various auricular zones. The BC line is defined as the line connecting the B point to the C point, following the curvature of the helix screws. This line is significant in auricular therapy as it helps map the therapeutic zones associated with specific bodily functions and conditions. The DB line is established by connecting the D point with the B point, forming a crucial conduit within the auricular zone system. This pathway assists practitioners in locating therapeutic areas related to emotional regulation and pain management. Practical applications of auricular points and lines. Auricular therapy effectively targets specific points to alleviate pain throughout the body. By stimulating these points, practitioners can encourage the release of endorphins and promote pain relief in various conditions such as migraines, joint pain, and muscle soreness. Auricular points related to stress are used in therapy to promote relaxation and reduce anxiety. By targeting specific zones associated with the stress response, practitioners can help individuals regain emotional balance and improve mental well-being. In addiction recovery, auricular therapy aids in addressing withdrawal symptoms and cravings. The targeted stimulation of specific points can support individuals in their healing process, promoting emotional stability and reducing the urge to relapse. This presentation highlighted the fundamental components of the Chinese auricular zone system, including the key auricular points A, B, C, D, and their respective locations and significance. Understanding the auricular lines A, B, B, C, D, B, and their roles in defining the auricular zones is essential for effective application in auricular therapy, contributing to holistic health practices.
Let's discuss WASHA for obesity, techniques and dietary recommendations, exploring WASHA techniques and dietary strategies for effective weight management and health improvement. Introduction to obesity. Obesity is characterized by excessive body weight and an accumulation of fat, primarily in the form of triglycerides. This condition not only affects physical health, but can also lead to significant psychological issues, including feelings of inferiority and depression. Understanding obesity. Obesity is characterized by excessive accumulation of triglycerides in the body, often indicating an increased fat layer and body weight. This condition can significantly impact overall health and quality of life. Genetics can play a crucial role in determining an individual's likelihood of becoming obese. Family history and genetic predispositions can influence body weight and fat distribution. An imbalance in metabolism can contribute to obesity. Factors such as hormonal imbalances, slow metabolic rates, and energy expenditure can lead to weight gain. Dietary habits, including caloric intake and food choices, play a significant role in obesity. Poor nutrition and unhealthy eating patterns can lead to weight accumulation. Mental health factors, such as stress, depression, and emotional eating, can further exacerbate obesity. Psychological well being is closely linked to physical health and weight management. Causes of obesity. Hereditary factors influence weight. Metabolic imbalance leads to obesity. Diet plays a crucial role. Lifestyle impacts weight management, and mental factors contribute to obesity. Psychological impact of obesity. Obesity is often linked to psychological disorders such as depression and anxiety. Individuals facing obesity may experience social stigmatization, leading to feelings of isolation and low self esteem. The impact of obesity can lead to a negative body image, contributing to feelings of inferiority. This perception can hinder personal relationships and social engagements, further exacerbating mental health struggles. Persistent agitation and stress from societal pressures and personal health concerns can lead to individuals with obesity to develop coping mechanisms that may not be healthy, such as emotional eating or avoidance behavior. Introduction to gua sha therapy. Gua sha therapy is an Asian technique that involves scraping the skin to improve circulation and promote healing. This method is particularly effective for addressing obesity by aiding in the adjustment of body fat and enhancing fluid metabolism, contributing to both prevention and treatment. Benefits of gua sha for obesity: enhances fat reduction processes, stimulates circulation effectively, promotes lymphatic drainage, reduces stress and mental fatigue, and facilitates detoxification processes. Recommended gua sha procedures: a structured approach to applying gua sha therapy for obesity management. First, we have Senshu, bladder 23, surface scrape, bladder 23 on the back from up to down until skin turns red or sha speckles appear. Yeah, next, we have Tanshong, Chongwan, Tianshu, and Guanyuan. Angle scrape CV17 downwards until skin reddens, then surface scrape CV12, stomach 25, and CV4 for 30 times each. San Yin Chiao, Susan Lee, and Fang Long, we use surface scrape, spleen 6 and stomach 36 on lower limbs and shin for 30 times each with moderate pressure.